So in terms of diagnosis, there's a wealth of information you can get from charities and from the healthcare professionals, but very quickly the diagnosis turns into a series of treatments. So how was that for you, Liv?
Well, because my cancer had gone into the lymph nodes, it meant that I needed to have chemotherapy. But obviously, first of all, I actually had keyhole surgery to remove half of my colon. So that was quite not too invasive because it was only 3 little marks in my belly. And that's how they managed to take out that part of the colon, so that was fine. The chemotherapy was a totally different kettle of fish, to be honest. It was quite an aggressive form. It was two chemotherapy drugs, fluorouracil and oxaliplatin. It meant that I had a PICC line in my arm for 6 months, and every other week I went to the hospital for some chemotherapy there, but also came away with what I can only describe as like in between a jam jar and a baby's bottle attached to my arm, which had a little balloon of the drugs in, and over 2 days that sort of was pumped into my arm. But I think what people don't understand is quite not just the invasive of the drugs. You have to go to hospital so many times. Now fortunately I only live maybe 4 or 5 miles away from the hospital, but it would be going to the hospital to have my bloods checked, going to the hospital to have my PICC line flushed, going to the hospital to have 4 hours worth of the chemotherapy drugs, go home with the bottle attached to me, go back to the hospital 2 days' time to get that taken off. So it's not actually just I'm having chemotherapy, it's the logistics of getting to and fro from the hospital. Now I was fortunate in as much as my husband had been a police officer, he retired, he was on a part-time job, and he stopped his work as soon as I was diagnosed. And he then was available to take me to the hospital all the time. I can drive, but obviously, as Stephanie said, one of the after effects of taking the chemotherapy is fatigue, tiredness. You just really don't feel like doing anything much at all. And obviously, when you've got this bottle attached to you, it's actually not very easy trying to change gear when you've got this line in your arm. So that's just sort of quite the minor part of managing it, really. But apart from all of that, there are quite a lot of side effects to the chemotherapy drugs that I was on, apart from fatigue, tiredness. Also, the oxaliplatin is a form of platinum, and it actually starts killing off your nerves in the tips of your fingers and toes. So it meant that I had numbness and tingling, very extreme sensitivity to cold, so I couldn't go in the fridge and get anything out of the fridge. I couldn't even take wet washing out of the washing machine because it hurt my hands too much. When we went out for walks, because I did try and keep active, I went with those things that you can hold in your hands, hand warmers, to keep warm, gloves on, fluffy socks. But I have to say, I did walk as much as I could. As much as I didn't feel very well, on the days that I didn't do anything, they were the days I felt much worse. Also, I carried on working through my chemotherapy. So the week I had chemotherapy, I didn't go into work, but the week I wasn't on chemotherapy, I went into work. So I had massive support. I only did 4 hours a day. I had massive support from my work colleagues as well. So stuff like that. One of the other things I really dislike, one of my favourite drinks is orange juice. I couldn't drink anything cold. It felt like thorns in my throat, absolutely horrible. So I had to have everything lukewarm, which was orange juice lukewarm is not nice at all. So that was, and I actually didn't have the full 12 episodes of the oxaliplatin because it was killing off the nerves, yeah. So the peripheral neuropathy, as it's termed, was getting too bad, and if it had carried on for any longer, it might permanent damage. Yeah. I've got very, very slight, not quite right in the fingers and toes, but yeah. So that, but you know, I had 6 months worth of that. I'm through that. I did a marathon 16 weeks after, so I did keep my training up as best I could when I was having chemotherapy, and that was key. Active keeping active. I think in my head, by keeping moving, it was moving the poison, the magic poison as I called it, round my body and meant my body was getting rid of it better. Obviously, hopefully doing what it was meant to be doing. But yeah.
Yeah, I agree, and I think it's about the blood flow as well.
Yes.
Remember oxygenation, getting plenty of oxygen to your organ, to your brains, to your liver, everywhere. This is also something we check when the patient comes before treatment. We check your saturation, and I think exercise will definitely help the saturation, the oxygen in your body. Yeah.
I'm guessing it doesn't have to be a marathon or an 8-mile walk. It could be something much less.
Yeah, you have a dog, take your dog out, just have even a walk is fine. Yes, just fresh air.
Even if it's just a 5 minute, if you're not used to walking, even a 5 minute walk, maybe 3 times a day, or, build it up.
Deborah, in terms of treatment and the kind of the research into the best forms of treatment currently, Vivian mentioned how exercise seemed to be helping her in her course of treatments. Has there been any research into that? Has that been found to be beneficial to people?
Well, interestingly, the orthodoxy is really that when you undergo very aggressive treatments, it's rest. It's about resting and not about putting extra loads on your body, and actually that orthodoxy is now starting to change a little bit, but it will be interesting to see, and very interesting anecdotally to hear about Viv's own experience of keeping going and keeping going while you're undergoing that regime of chemotherapy. So I think that there's nothing substantive in terms of an evidence base yet, but I think it will be coming some point in the future. So I think the way that we will treat patients within the system will actually change quite radically, potentially within the next 5 to 10 years.
I mean, treatment is not easy, and it can be grueling, and the role of Beating Bowel Cancer's online forum is fantastic in terms of patients sharing their lived experience of treatment and the tips and tricks that help them deal with some of the challenges of that treatment, because everyone is different. But when you've got thousands of people sharing their experience, things like how it affects your taste buds or your the numbness and so on, and then how you can cope with that, the impact of that peer support is fantastic. So certainly I would recommend people looking to the online forum for support throughout the cancer journey, actually.
We do have at BMI to Chiltern, we have once a month something called Upfront. It's a monthly meetup. I don't know if you are aware of that one. So people who have been through a cancer journey, they will meet up, or are still through the cancer journey. They will meet up once a month in a massive room at the hospital, and it's just we bring cakes and drinks, and we just have a chat, and we just get advice from each other, and it works really well, and I think it helps people mentally as well and emotionally.
That's the end of this part of the discussion. If you want more information, look out for the other episodes in this series and visit our website at bmihealthcare.co.uk. Look out for the Be Bowel Cancer Aware campaign page where you can download our awareness guide.